Esther Dyson, we see you now in Nantucket here. We know you from the tech scene, and we know you're always into new projects with a lot of exciting challenges. But what are you into now? Healthcare?
No, I'm into health, not health care.
Yeah. Health production.
Yes, health production. So instead of waiting till you get sick and trying to fix it, why not live healthy and stay healthy? It costs a lot less.
Yeah, that sounds like a very simple idea. Much more popular in Europe than in America. So how are you going to try that out? How are you going to find a community to make that work?
We found 41 communities that want to do it, and we're going to work very closely with 5 to help them do it at scale, because it's not simply someone deciding, it's a community getting together to change the environment that people live in.
Mm-hmm. Yeah, to live healthy is a hell of a job if you want to do it on your own, and to do it in the community is easier. How can your new venture help to make that easier for a community?
Well, again, we're going to go to the communities and help them do what they already want to do: fix school lunch, put in bike paths, do diabetes and asthma prevention programs, and we're not doing anything new or technologically advanced. We're doing just what everybody knows they should do, but we're going to be doing it at scale in these small places so you can really see the impact.
Mm-hmm. The communities, what kind of size are they, and how are you going to infiltrate those communities, or what kind of support organization are you looking for inside an organization like that, inside the community?
So the communities are less than 100,000 each, and we don't need to infiltrate them. They've invited us in. And yes, they need to make sure that this is bottom up, not just top down in their communities. Mm-hmm. But we're looking for communities that have that understanding, and we're just going to help them do what they already were doing.
Okay. How are you going to help them?
Bring in experts, bring in money, bring in vendors with programs. One community said, we tried to talk to Safeway and they wouldn't respond to our call. We can get people to return their calls.
Mm-hmm. And you say also, one article you mentioned, the obesity can be fixed with fast food. How does it work?
The article was how junk food can solve the obesity crisis. It should have been how junk food companies can solve the obesity crisis by delivering healthy food at scale the way they right now deliver unhealthy food at scale.
Mm-hmm. Yeah. So basically, you don't want to do it against the current industry. You don't want to do it against the current system. You just want to help the current system to transform itself to produce health.
Yeah, we want to work with the food companies as friends and allies.
Okay. When are the first 5 communities going to be selected?
Middle of August.
And then when is the project going to start?
It's started already.
Because everybody's already thinking about it.
They're already doing stuff in their communities. We're just going to help them do more and more effectively.
Where can we read about it?
Hiccup.co.
Okay. Thanks, Esther.